UBC, inspiring Uganda.
Hello viewers, welcome to the program Safe Life. My name is Ishimwe Kathy, and today I'm with Dr. Ntwatwa Lule, a dental surgeon who is going to be taking us through milk teeth, premature teeth, and something that is commonly known as ebinyo. We literally didn't find the English word, but we are going to be taking you through.
Hello viewers, it's nice to be back on the program once again. My name is Dr. Ntwatwa Lule, and I'm a private dental practitioner. The human being has two sets of teeth. The first set of teeth comes into the mouth at around the age of 6 to 9 months. They start with the lower front teeth, then other teeth start growing. And altogether, the first set of teeth is comprised of 20 teeth, 10 up and 10 down. And those are called the milk teeth, or they are the deciduous teeth. After around the age of 5.5, the lower front teeth are usually the first teeth to become loose. They are taken out and others grow. And the process continues until all the 20 baby teeth have been removed and a new set of larger, stronger teeth come into place. And those in total are 32 permanent teeth. And that's the permanent set. The first set is the deciduous set, or the milk teeth, and the second set is the permanent teeth. Total, 52 teeth in total. Why are they called milk teeth? Possibly because the first set of teeth start growing at the time the baby is consuming milk all the time. I think that would possibly be the best reason. Ebinyo is a term used for an ailment that young babies get. You see, when a person holds an object, they can see it. When they touch it, they can feel it. Now, for a baby, they tend to use their mouth to feel structures. Not only that, actually the baby 100% of the time is interested in just eating. So, wherever they go, when they're crawling, they touch anything that moves, straight into the mouth. And of course, if they're crawling along the floor and it's not clean, you're going to get, sooner or later, bacteria, and the mouth is likely to be infected. Very frequently, the gums get infected because of the area the child's hands are not clean. And what tends to happen is sometimes the gums can swell in those areas. The child is irritated. There is a poor feeding. Occasionally, they can get a running stomach or some diarrhea. There's poor feeding. Occasionally also there's poor sleeping or lack of sleep. So this that goes on is sometimes called ebinyo by the local people, but it's usually an infection caused by the area the child is not very clean, lack of cleanliness. The diarrhea is caused by substances which are not clean, which are ingested. They're placed into the mouth, and eventually what goes in the mouth into the baby's mouth eventually gets swallowed. And if it's not clean, the chances are it will cause an irritation in the gut, and the child will get a running stomach. Commonly, for the adult, we call it food poisoning. You can get a stomach pain, running stomach. You can even get fever, lack of sleep, poor feeding. Those are all effects of a small amount of food poisoning. It's not coming from food, but it's something that is ingested that is not clean. The local herbalists tend to treat this ailment by usually poking in the gum, and they seem to suggest that there is a worm inside the gum. The side effects the extractions can cause: one, missing tooth. Usually in the site where the herbalists remove the so-called worm, actually it's the gem of the tooth, the gem of the growing permanent tooth that is usually removed. If it's not removed and he doesn't do a good job, he just damages it. See, the tooth, before it becomes hard, it's jelly-like as it's growing. Then afterwards it calcifies and becomes hard. So during that stage, most of the teeth are jelly-like, and it is possible just to poke the jelly-like tooth gem. So eventually when the tooth grows, it comes in with an indentation or a deformity on its structure. Frequently, the actual tooth gem is totally removed, which means that there will be a missing tooth. Now, if the damage is a lot on either side, you have the missing tooth gem and then damage to the teeth, the permanent teeth that grow on either side. They also come with damage. So the effects of the treatment of a vinyo can sometimes be seen when the permanent teeth have grown. My advice would be that if a child is sick and is having diarrhea, it's always best to take them to a general hospital or a clinic. When children have diarrhea, they lose body fluids, and those body fluids need to be replaced quickly. And so the child usually needs some sort of fluid replacement and also treatment of the infection, rather than to produce further damage in the mouth, which will further prevent the child from eating or drinking. Usually those teeth, when they erupt, they're actually erupting when they're already decayed. And usually the cause is usually a baby bottle. So you have a baby bottle with 4 little holes. And when the baby uses that, especially at night, it destroys all the teeth. Why? At night, when it's time to sleep, the salivary flow stops. Now, whenever you put sugar into a baby's mouth or milk, eventually you'll get sugar anyway. When you put milk in a baby's mouth, it usually contains some sugar. Then, when someone is awake and you have salivary flow, that sugar is washed away by saliva and is swallowed. If it is done at night, when the baby is supposed to be sleeping or sleeps soon after, the salivary flow stops. And if there is still milk inside the baby's mouth, it will not be washed away by the saliva. So it will remain in the mouth until the morning. So the baby's teeth will be exposed to sugar all night. Now, tooth decay is caused by 3 factors being together at the same time: the tooth, bacteria, and sugar. The longer you have those three items together at the same time, you are promoting tooth decay. So if you have a sugary drink in the baby's mouth and it's there all night, the chances are there will be some bacteria. You're likely to get decay occurring all night. All the teeth will be destroyed.
Did you know that the baby bottle can cause decay? Well, let's have the doctor explain to us different ways how it does it and the different things that we can use instead of the baby bottle, which is the cups without the lids. Let's have the doctor explain this to us.
In many cases, the baby bottle is also given as a pacifier to try to keep the child quiet at night, giving the parent time to sleep. And one should always avoid using anything sugary inside a bottle. Pure water is the only thing you can put in a baby's bottle that will not promote tooth decay. Anything else will promote tooth decay. So avoid sugary drinks, put only water in as a pacifier if needed. Then it's always best to clean the baby's teeth and gums after every meal or after every drink. You can use a cotton bud or just ordinary cotton or tissue and wipe off any excess milk that may have attached onto the gum. Also, try to introduce a toothbrush, a baby toothbrush, at least after year one, and also clean the baby's teeth for them. Introduce the toothbrush to the child as a game, not as a punishment, so that it is an enjoyable experience for the child. Be a model first as the parent. You brush your teeth first, and then tell them that you're brushing their teeth as well, and then offer them the toothbrush so that they can do the job as well on their own. That way, the child will develop the good habit of brushing their teeth regularly. Be the first dentist. Regularly check the baby's teeth for any dark spots and anything that doesn't come off. Any discoloration of the tooth, first you can use a toothbrush to try and brush it off. If it persists, seek the advice of a dentist. Have a dental checkup for the child at least every 6 months. In case any cavities are discovered, they can be treated while they are still small. Using a toothpick to clean between the teeth is a bad idea. Toothpicks can damage the teeth and the gums. Why? First of all, they're sharp and you're not looking at what you're doing, so it's very easy to poke your gums. And if food has been there for a long time and has been stuck and the area is not clean, you're going to introduce bacteria inside the gums and you're going to get infected. Also, the toothpick can break and a particle of the toothpick can remain lodged in between the teeth inside the gum, and that's painful. So you should avoid using a toothpick to clean between the teeth. Also, toothpicks are not the right shape to clean in between the teeth. You see, the teeth if you have 2 teeth here, the outside of the tooth is convex, like this, and this tooth is also convex. The toothpick is also shaped when you come to contact the toothpick comes to contact the tooth. It's also convex in shape. So you are going to have point contact between a toothpick and the tooth, not surface contact. So that's another reason. The amount of contact you have between the toothpick and the tooth is not enough to clean the teeth adequately. Remember also, you're just poking in between the teeth. So you're basically trying to pick out what is there. And ideally, it should be shaped as a hook rather than a point. But let them not change the shape. When you push through, basically you can push the food further into the gum or try to force it out the other side. Either way, it doesn't really work well. It's not a good idea. The other thing that tends to happen is that when you force the toothpick between the teeth are pushed apart. And little by little, they tend to lose the tightness between their contacts. So the contact becomes loose, and eventually you actually get a gap, simply because you're forcing the teeth apart regularly. Eventually, the food will tend to pass there even more easily and get stuck there. So it's not a good idea. If you want to clean between your teeth, use this stuff over here. This is dental floss. This is what most dentists will recommend you to clean between your teeth. So, how do you do it? Wrap it around the middle finger. And wrap it around the other middle finger. You can control it using your forefingers and your thumbs, depending on which area you are cleaning. Have a short distance on either side of the tooth. Place the floss between the contacts gently so that you don't crash into the gum. Wrap it around one tooth, slide up and down. Wrap it around the other tooth, slide up and down and out. It's a bit tricky at the beginning, but if you hold it properly like this, wrap it around the middle finger and have your finger and thumb to control, you'll find it much easier after some time. That's one thing. Another thing you can use between your teeth are interdental brushes. And they look like this. They come in different sizes depending on the size of the space between your teeth. But interdental brushes are usually prescribed by the dentist when the person is suffering from a certain amount of recession and the space is quite big. You see, in between the teeth, you have the gum over here in the interdental space, right here. The gum is supposed to lodge in between there. So you're not supposed to have any space. And if you place a toothpick, an interdental brush there, you may not do a good job because you will be displacing the gum. So this is usually prescribed when the person has suffered from gum disease, the gum has recessed, and you already have an open space in between here. The dental floss can work, but an interdental brush is also very efficient in cleaning that space in between here where the gum has recessed down and there's a huge space there. And the bigger the space, usually you'll find a slightly bigger brush to be used in that area. So an interdental brush is also something you can use to clean in between the teeth. When do you want to brush your teeth? Well, there are two schools of thought. Some people say, as soon as you finish brushing, run to the bathroom, brush your teeth, get everything nice and clean, and go. Another person will say, nope, brush your teeth first before going to eat, then what happens after eating if there's food left in? That's a question many people are confused as to how to answer it. Let me think. Okay, we can answer it this way. Make things easy. Let's remember how tooth decay is caused. Tooth decay is caused by having three things together at the same time: the tooth, sugar or food containing sugar, and bacteria. When those three things are together, you are promoting bacteria. If you eat food in the presence of bacteria, you're promoting tooth decay. If you introduce bacteria in the presence of food, you are promoting tooth decay. The bacteria come all the time. You clean your teeth now, make them spick and span. After a couple of hours, you breathe in air, you touch, bacteria are introduced. Then they grow, they multiply. At the end of the day, everything's dirty. You have to go and brush again. So, the question, should I brush before eating or after eating? You want to prevent tooth decay and gum disease. So, you want to prevent the three things being together at the same time: the food, the bacteria, and the teeth. The teeth have to be there. You can't do without them. Okay? The teeth have to be there. So it's the other two. Now, before you eat food, you've been out during the day. Bacteria have accumulated. So you have two things. Your teeth are there, and the bacteria are there before the meal. If you don't brush before and you eat food, you're going to have all the three together, right? You're going to promote tooth decay. Let's see if we can do it another way. You're about to eat a meal. You have two things together. Bacteria are there and the teeth are there. You're about to introduce the third one. And you say, let me go to the bathroom first and brush. Take away the bacteria, introduce the food. Then have a rinse afterwards. You only have two of the three. Does it make sense? Think about it. And if you do, you will be able to make your own choice. Primary teeth and milk teeth are the same. They also have another term, deciduous teeth. And you may ask, why would we look after the primary teeth? After all, after some years, they're going to be lost. So why care for them? Well, the primary teeth are there for a function. First of all, the teeth, when someone smiles, gives the child a good appearance. When they lose their teeth early, they will feel somehow slightly degraded when they smile and their peers have a nice smile with all their teeth. See, everything has a time. And when it's time to lose their teeth, which usually happens at a certain age, when the child has gaps, everyone else will have the same gap as well. So you're part of the group. So you don't get that psychological trauma of having lost your teeth early and not smiling like the rest of the gang. The teeth should also be used chewing food. If teeth are not looked after well and they get infected, especially with tooth decay, then it becomes a painful experience for the child, and the child will not eat well. If the teeth are not looked after well, and the parent has to take time off as an emergency to have the child treated, it means time is also used inefficiently. Whereas if you schedule an appointment before the pain occurs and have the teeth checked regularly, then when you have a small cavity, it's far easier to treat. And also the experience for the child will also be less traumatic, as opposed to when they turn up when they're in pain. When many teeth are infected, there's a lot of bacteria in the mouth, and if you treat the teeth, you prevent bacteria from spreading to other places in the mouth and to other places in the respiratory system. With a lot of infected teeth in the mouth, especially when it comes to tooth decay, when the child breathes, air passes the teeth and goes all the way into the lungs and out again every time they breathe. So as the person inhales, they also inhale the bacteria that are in the mouth, and they end up in the respiratory system. And one of the causes is bacteria infection, chest infections, sinus problems, throat infections, and those will occur simply because of tooth decay from a child's mouth. So it's important to look after the child so that the child can grow up normally and happily and lose their teeth at the right time. When the teeth are lost at the right time, they help to guide the permanent teeth into a good position. When teeth are lost slightly early, then the permanent teeth can erupt also early. When the child's teeth are removed very early, it actually delays the eruption of the permanent tooth. And during that time that the tooth is missing, space can be lost because the teeth on either side, especially when crowded, can come into the space, and then there will be more problems when the tooth that's supposed to erupt in that position doesn't have a position to come into. So there are good reasons why the child should be taken to the dentist regularly. The child can also develop a rapport with the dentist when they are taken regularly, especially before an emergency occurs. It is far easier for the dentist to help the child develop a rapport, develop a friendship with the dentist. And then it will also become easy for the dentist to instill into the child good home practices of avoiding eating sweet things and also brushing on a regular basis. So all in all, it's always good to look after the children's teeth and the child also to feel that they are being looked after. A healthy teeth leads to a healthy mouth and a healthy body. Thank you for listening.